Let's talk about how to overcome allergies naturally. So before we jump in directly to that, let's talk about the symptoms. I mean, I get this a lot. People come to see me. It's very common. GI problems, headache are common symptoms. Joint pain can be a common symptom of histamine release. Remember, histamine is what causes the symptoms of allergy response. We get histamine release. It's a normal chemical that our immune cells produce. And so it doesn't necessarily even have to be histamine intolerance. There's some people that are histamine intolerant, but it could just be histamine. The histamine burden is too great, and your body doesn't have the capacity to deal with that. And so these are, again, the symptoms. So if you look up here in this diagram, you'll see a lot of the respiratory symptoms that people associate with seasonal allergies. Runny nose, okay, inflammation of the nasal passages, congestion, shortness of breath. Other symptoms can be watery or teary or itchy eyes, coughing, wheezing, sneezing, right? The typical things that people struggle with. And so a lot of people jump to these over-the-counter kind of drug-like remedies, like things like NyQuil and congestion aids. Again, those don't come without a price. And if you're gluten sensitive, so key here, if you are gluten sensitive and you're jumping to these over-the-counters, you're going to get in trouble, because OTC allergy remedies contain gluten. Almost every single one I've ever looked at over the counter contains some form of gluten. So the problem with that is if you're having symptoms of allergy and you jump to this right here and you're getting gluten exposure, you might get minuscule or minimized benefit from using these types of therapies, aside from the fact that these types of therapies largely suppress the immune system, which isn't a great idea to begin with. But you get glutened, and that's key, and we'll talk about that in just a minute, so keep that in your mind. You can see some of the other symptoms here: headaches, migraines, dizziness, okay, tachycardia, which is a heightened or increased heart rate, and then hypotonia, collapsing or passing out, menstrual cramps. Ladies, you didn't maybe think that histamine exposure during allergy season could make your cycles more aggressive and worse, but it's a very, very common thing that happens. And then we get GI symptoms: the bloating, the flatulence, the fullness, the potential for diarrhea and pain, constipation, nausea, vomiting, and then as well with the skin. A lot of times seasonal allergies manifest in the skin, the inflammatory aspects of what can go on with the skin. So some people develop urticarial wheals or flushing of the skin, or just generalized inflammation and swelling of the skin. So again, a lot of people and a lot of doctors really predominantly focus here, right? They focus maybe a little bit here under dizziness, because that sometimes is more considered. And then they focus, for the most part, around nausea and vomiting, and then that facial symptoms, the itchy, teary stuff. So again, it's deeper than that. And a histamine reaction from an environmental allergy, seasonal allergy, can cause any number of these different symptoms to develop. And so again, if you're gluten sensitive and you're using the over-the-counter allergy meds, you're going to run into problems because they contain gluten. Now, what's interesting about that is we look at this research study, non-responsive celiac disease. So what does that mean? That means that people have gone gluten-free, right, and they did not respond to the diet. And one of the reasons why these doctors studied that is because additional food intolerance, malabsorption, including histamine intolerance. So let's first look at what they had to say. Histamine intolerance was found in more than 50% of their patients, and it seems to play an important role in non-responsive celiac disease. So again, going back to, if you are gluten-free and you're not responding, one of the findings of these doctors is that more than half, right? So 1/2 have an issue with histamine intolerance. I mean, they can't tolerate more histamine. Now, what happens during allergy season is we're exposed to all these environmental agents, the pollens, the molds, the dust, the dander, the things that happen during the spring. And we already have a poor ability to deal with histamines, okay? And so the overwhelm comes, right? So we get exposure to much, much more environmental exposures that trigger histamine release. And so, whereas maybe now, if you think about this as your histamine bucket, your body can only take so much. So if this is your histamine bucket and you're gluten sensitive and you have a histamine intolerance already, because half of you do, your bucket's full. So imagine, or it's kind of to the top, if that's the level, right? And then allergy season kicks in, and we get all these stimulus or stimuli that increase the bucket further. And so what happens is it then starts to overspill. And when it overspills, this is when we develop the severity of symptoms, right? So we got too much histamine, we can't break it down. And so if histamine is a vasoactive amine that causes all the symptoms that we associate with allergic response, with allergies, right? And so again, but if it's happening in the spring, then you know, even if you're eating gluten-free, again, you may not deal with histamine very well, and so the spring, it kind of overloads your system. So it's a common issue in people with gluten sensitivity. Now, I want to point something else out. If you're having symptoms year-round, you don't have allergies. I get this a lot. People say, yeah, I take my allergy medicine every day, and I've been taking it every day for 5 years or 10 years or fill in the blank. You don't have an allergy problem. You've got a food problem, and you have an immune system problem. You shouldn't have to suppress your immune system 365 days a year just to survive the day without having severity of allergy-like symptoms. So if your symptoms are year-round and they're not cyclical, they're not spring and they're not fall, you have an immune problem, not an allergy problem. And you've most likely been misdiagnosed and you've been told the wrong things. And again, why is this so important? Because many of the drugs that people use to cope with year-round allergies are right here. Over-the-counter allergy remedies. And guess what? Again, a lot of them contain gluten. And so now you're gluten sensitive. You already maybe have a problem with histamines. You're reacting all year round, so you're using a medicine that contains gluten in it. So you're glutening yourself in an effort to defend yourself from the symptoms that haven't gone away, because nobody's told you the truth about why your symptoms actually exist. So it's super important that you understand that connection, especially between gluten sensitivity and histamine and allergies. So immune problems versus seasonal allergies. If your symptoms are year-round, you got an immune problem. If you find yourself reacting aggressively to foods, you have an allergy problem and you have an immune problem. If your symptoms are largely in the GI tract, we generally tend to think food more aggressively. If you've got generalized muscle joint pain, stiffness, then again, food, we think of food because it's going systemically. Now, what should you do? How do you go about figuring this out if you are in this situation? Now, number one thing that you can do is get tested for food sensitivity. It's probably the best thing you can absolutely do, because a lot of times what happens, remember, going back to what we said here, if your bucket's already full and it only takes a little bit, and now you throw in some foods that you're reactive to here, and you have, environmental stuff over here, and so those things are coming in, and then you're still eating foods that you're reactive to, this bucket just spills over, you get aggressive symptoms. So this is why testing for food. Why? Because if we test for food and we know what to remove from the diet, then we take away that component. We can't control the environmental component. The season is the season. You're going to have things in the air. Now, you can filter your air, and you can stay indoors on high allergy count, high spore count days. You certainly can take that and have that behavioral activity around protecting yourself the best that you can, but food you can control. And so testing allows you to then manipulate your diet so that this bucket, you're taking away one of the inputs, right? And that's going to lower that level so that when allergy season is here, you've got more room to fill that bucket. That bucket can hold more, and you become less apt to develop aggressive symptoms, because that's what happens to a lot of people. Oops, went too far. A lot of people get stuck in this place here where they're symptomatic year round, and they don't know what they should or shouldn't eat. And even this is beyond gluten, because again, gluten sensitivity could be part of this issue, but it may also not be just gluten. I've seen people that were allergic to broccoli and cauliflower. I mean, healthy foods, superfoods, you can still be allergic to. So this is important. So food sensitivity and food allergy testing, get it done. Get it done so that you can manipulate your diet. You also can check, one of the other big things I see very, very commonly if it's year round is mold in the home. So it's like home exposure. You live at home, right? And your home is your haven. It's your safe place. And if your home has mold in it and you're being constantly exposed to mold is going to be one of those environmental things that's just filling up your histamine bucket and really getting you to overload. This actually happened to me in my house. We lost our house. What happened was we were finding, I was particularly, my eyes would just itch. I'd lay down in bed at night and I would sneeze for a little while and my eyes would just itch. They were on fire. I'd like to think I'm a healthy person, but it just wouldn't stop, right? And what we actually ended up finding out is that we had a major mold issue in our home. And once we dealt with that, got out of the exposure, okay, then the eyes completely cleared up. The allergy symptoms completely recovered, which is, ideal. The other thing you want to do here is get tested for vitamin and mineral deficiencies. And we'll talk about this in a minute, but there's certain vitamins and certain minerals that are important for your body's ability to be able to break histamine down. So remember, histamine is a chemical your immune system makes in response to allergic exposure. And if your histamine levels are too high, you'll become very symptomatic. So the solution is take away the things that are driving the histamine exposure, number one, and number two, make sure you have adequate nutrients so that you can break histamine down. Your body naturally has the ability to break histamine down, and that requires certain vitamins and minerals. So getting tested there becomes important if you want to minimize, again, your symptoms and exposure long term. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.